8 things that we wish you knew before postpartum so you can be better prepared when they happen to you. First up, postpartum bleeding or lochia. This is going to last 4 to 6 weeks, and you want to prepare by having a lot of pads on hand. Pay attention to that bleeding because it can tell you a lot about your recovery. Next up are the postpartum shakes. These can happen in the first couple hours or the first couple days due to adrenaline, hormone shifts, and blood circulation changes. You can prepare by staying warm, focus on your breathing, and doing lots of skin to skin with baby for co-regulation. Next up are after pains, as the uterus is working hard to contract back down to its pre-pregnancy size. This may feel more intense while nursing due to oxytocin being released and helping trigger those contractions. You can prepare for this similarly to period cramps, having a hot pack on hand, focus on your breathing, and using mild pain relief as prescribed by your doctor. Next up is log rolling out of bed. You should still be log rolling or rolling to the side and pushing up because your core and your pelvic floor are really weak and you could cause injury by forcing yourself to crunch up out of bed. This is especially true for C-section moms. You want to protect that incision. So we want to roll to our side, use our arms to push up, and swing our legs off of the bed to help protect the core. Next up is postpartum odor. You're going to smell not great. But remember, this is only temporary. This is due to the lochia and all that blood and mucus your body's shedding, as well as some major pH and hormonal changes that are happening. So you can prepare for this by changing your pads regularly, using a peri bottle, and staying hydrated. Next up is the first postpartum bowel movement, which can feel really scary due to weakened pelvic floor muscles, the fear of constipation, and also the need to protect stitching that might have happened due to tearing. So what you can do is stay really on top of your hydration. Make sure you're on top of your fiber intake. Utilize stool softeners as prescribed by your doctor. And then also giving some perineal support with your hand or a warm washcloth. This provides some reassurance and support to those weakened pelvic floor muscles and makes you feel less like everything's about to fall out of you. Next up are postpartum hormonal and emotional changes. The postpartum period is a time of major hormonal shift. So there's a couple things you can do to try to cope with this. First off is acknowledge those emotions. It's okay to feel really low lows and really high highs at the same time. Listen to them, cry, and breathe. Next is communicate with loved ones. They're there to support you. And finally, communicate with healthcare professionals as needed. PPD and PPA are very real things, and there are people there to help you. You are not alone. Lastly is engorgement, when the mature milk comes in 2 to 5 days postpartum. This can lead to a lot of swelling and breast tenderness and make it difficult to latch baby on. So what you want to do is avoid applying heat unless you're trying to encourage milk to come down. This can be helpful right before latching baby. But instead focus on cold compresses and cold cabbage leaves, which sounds weird but does help with inflammation. Avoid tight-fitting bras and hand express to relieve pressure as needed. The more we talk about postpartum, the more prepared we are and the more empowered we are to take on this challenge. Give yourself grace and lean on the support that you need.